I've been using Omidria for approximately 1 year, and we use it on any patient who has insurance coverage for the medication, and I've been very happy with the product. The Omidria comes in a small vial, and it's injected into the BSS solution that is used for your phacoemulsification. So after putting the BSS in the bottle, you can simply just use it with your procedure. So when we start the case, I make my side port incision, I put in my lidocaine, and I put in my Omidria. And the product, I feel, works excellent. It's very, very different than epinephrine. The epinephrine solution is nice when you don't have Omidria. It's better than nothing, and it has been a staple for me for the last 20 years in helping to keep pupils open that want to come down, or for IFIS. It helps you get through without having to insert a Malyugin ring in all of these cases. But Omidria, in my opinion, works far better than intracameral epinephrine. The Omidria not only maintains the dilation of the pupil during the cataract surgery, but it also changes the behavior of the iris. The iris does not flop around the way it does without the Omidria. It doesn't flop around the way it does with epinephrine. Something changes. It becomes stiffer and more manageable. Furthermore, I find that the pupil is actually more dilated at the end of the case when I'm using Omidria than it was at the beginning of the case, and that includes my difficult cases with floppy iris and small pupil. I have not had any issues with the Omidria. I have not had any patients complain about the stinging or burning with the product. I have not had any problems with it in the operating room. It really has been a product that I have been surprised with. There was a lot of controversy around it because of the cost of the product. It's an expensive product, and many people feel that epinephrine is just as adequate and the cost is not justified. And I just decided to use it for myself and see how I felt about it instead of listening to other people. And that's what I would recommend. If you have the opportunity, try it and decide for yourself and see how the eye behaves in surgery. And if you really have the opportunity to use it for a small pupil case, then go for it, because I think you'll really be surprised. But I used it and I really felt that the product was great. I think the patients post-operatively are a little more comfortable. I think their eyes are a little more quiet. They do stay dilated a little more though. So you just have to give them a little bit of a heads up about that. They generally don't mind it. And their pupil comes down, maybe might take an extra day to come back down to normal size for them. And I don't feel that that has been a concern.